Hello everybody, today's video is about using natural treatments for mycoplasma / ureaplasma affecting the urogenital tract, and also about treating hydrogen gas producing SIBO. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the first topic is from a question that goes like this. Regarding ureaplasma, is it possible to treat it with herbal tinctures, or do prescription antibiotics need to be used? Also, isn't it part of the normal flora for many people? I read somewhere that it isn't always pathogenic, so if our terrain is in better condition, it makes it less susceptible to ureaplasma dominating. I recently started estrogen therapy, and to my surprise, many of my urinary symptoms went away. I later read that this could be because estrogen influences the pH of the whole vaginal/urinary tract. If estrogen is adequate, the pH will be low enough that infections like ureaplasma or Gardnerella will not be able to thrive. Is this correct? What has your experience been in treating patients with ureaplasma? If ureaplasma and Gardnerella are both present, confirmed by lab tests, but not causing symptoms, is intervention necessary? Thank you for your videos. They are enlightening. So thank you. I'm glad that my videos are enlightening. That's very high praise. So thank you for all the questions. And yeah, I've posted a number of videos about ureaplasma / mycoplasma, and it's something that I've treated a fair number of cases with over time. I've had patients who absolutely have had a resolution as confirmed by laboratory testing and by symptom resolution, not needing pharmaceuticals to get rid of ureaplasma. So it is achievable. It sometimes takes a really long time, like months and months and months. I've had some patients take the better part of a year to get it cleared out. And I've had patients who have been like plugging away at it for, sometimes years before they came to see me, but generally they haven't been working with a strong enough treatment dosage of things, and or they have not been using biofilm disruptors. So biofilm disruptors are very important in my experience in all of the very challenging recalcitrant cases of ureaplasma that I have worked with up to this point. And then you have just making sure there's a high enough dose of herbs, and then making sure that we're working with the right herbs. So sometimes folks are taking herbs that are just in a form or of a type that are just not very well absorbed. And if we just think about it, we put our thinking caps on. If we take an herb that we want to then treat the bladder, it's going to have to get into the circulatory system. It's going to have to get into the bloodstream, and then the blood and the drug or herb or whatever that's in there that we want to use is going to have to get filtered out through the kidneys. So if someone comes in saying like, oh yeah, I'm taking, like say, I don't know, wormwood capsules, it's like, yeah, wormwood does get absorbed, but like a tincture is going to work way better than capsules. Or if someone comes in saying like, oh, I'm taking berberine because I heard berberine's good at killing stuff, it's like, it is, and it'll kill mycoplasma and ureaplasma in a petri dish, I'm sure, but berberine, to my understanding, has a very poor absorption. So like how much of that is actually going to get through the kidneys? Now you start getting into things like cryptolepis tincture or Japanese knotweed tincture, Sida acuta tincture, Knocklea tincture, like some of these herbs that have a really strong antibacterial action to them, and they get into the bloodstream effectively, in my experience, then those are likely going to be a lot more effective than encapsulated herbs. And not to say all encapsulated herbs won't be well absorbed, but we just really want to think about like the actual sort of pharmacokinetics, if you will, of the herbs that we're using. And then again, the biofilm disruptors rather are just, in my experience, like so important. But even when we have the right biofilm disruptors on board, things like bismuth, alpha lipoic acid dithiol complex combined with a chelator, a chelator like DMSA or DMPS, like, so in my opinion, the strongest biofilm disruptors that we can work with, even in those cases, it can take months sometimes to get these things to resolve. Now the question about like, are these microbes always pathogenic? My understanding is that they're not. So if a patient came in saying, for whatever reason, I don't know why you'd have a urine culture done if you didn't have symptoms, if one didn't have symptoms, but if someone came in with a urine culture saying, oh, I've got ureaplasma and I have no symptoms whatsoever, it's like, well, maybe that's okay. Now if it's a culture, that's probably, it's probably worth treating. If it's a PCR analysis and we're just seeing mycoplasma DNA, which we really can't use to my understanding, to like definitively enumerate the amount of mycoplasma that's there, that might be a bit of a different story. But my understanding is that it can be part of the normal ecosystem in the bladder / urinary tract. So not necessarily always pathogenic, to my understanding. As far as the estrogen question goes and the pH and everything, yeah, that's my understanding as well. If there are if there's an estrogen deficiency, that's going to throw off the pH, is going to make the vaginal canal less acidic. There's going to be more critters that are going to be able to grow there, and then the microbes can start to migrate up into the urinary tract and start causing problems, especially if they get all the way up into the bladder. So it's either going to cause chronic embedded UTIs or possibly a chronic bladder infection. So long and short of it is, yes, I've come to the same conclusions about estrogen, and the terrain is certainly very, very important. So I hope that answered all the questions. I think that I did. And if I didn't, then just post in the comment section and I will happily answer the rest of them in a future video. The other question that came up was about treating hydrogen SIBO. So it says, what antimicrobials do you usually put your hydrogen SIBO patients on, and how long after starting should one see some relief? So my go-to antimicrobials for hydrogen SIBO, rifaximin, of course, is the drug of choice, the antibiotic of choice for treating all types of SIBO. But here in Nova Scotia, where I practice, it's not impossible. It's becoming easier for patients to access rifaximin, but it can be quite expensive because most drug plans don't cover it, and it can be hard to find a doctor who will prescribe it. We do have doctors that we work with who do prescribe it, but it just can be a little bit, anyways. Oftentimes we use herbs because they're easy to access and they oftentimes work very, very well. So my go-tos for hydrogen SIBO are enteric-coated oil of oregano / oregano essential oil. I find that tends to work really, really well in a majority of cases. However, the one side effect from any oral essential oils is that some patients will get heartburn / reflux from that, and so that can be a rate limiting step. So especially if a patient comes in saying, I've got all these SIBO symptoms and I have heartburn or reflux, probably going to want to use something different. But it's not a hard and fast rule, but that can be a rate limiting step with it. I also really like using berberine. So just talked about how berberine might not be the best choice for urinary tract issues because of the absorption issue, but in the intestinal tract, we don't want the berberine to be absorbed. We want it to stay unabsorbed and just pass through the intestinal tract. So I'll oftentimes recommend a combination of berberine and oregano essential oil. That's kind of my typical 1-2 punch, along with diet. Of course, we want to starve out the SIBO as well. So using a paleo diet. I've had a recent video kind of talking about the optimal diet for SIBO or something like that. So please cross-reference that if you're so inclined. But usually a modified paleo diet is what I like to work with. And then berberine and oil of oregano. If the oil of oregano is not an option, then I'll oftentimes use a combination formula called dysbiosis formula. It's equal parts wormwood, grapefruit seed extract, and black walnut. I find that oftentimes works well. I know that some clinicians like to use neem, which I have used in the past, and it can be helpful, but I just find that the dysbiosis formula and berberine or berberine plus oregano oil tend to work better. So I tend to use that. There are certainly other antimicrobials out there as well that can work, but those are my go-tos, and that was the question. How long should one need to wait before they start seeing relief? Generally, when the patient's doing the diet at least, say 75% of the way, and they are on the full dose of the antimicrobials, then typically we'll start to see improvements within, usually the first week, 1 to 2 weeks anyways. If there's no change within the first couple of weeks, we're probably missing the mark. Either SIBO is a red herring or the treatment protocol is just not working for some reason. One other thing I will mention is that in a lot of cases, I will put my patients with SIBO on a really strong digestive enzyme. Usually recommend a pancreatin enzyme, so like a pancreas extract usually derived from pig pancreases. I've posted some other videos about something called exocrine pancreatic insufficiency, or EPI for short, and I find that a lot of my patients with really tough to treat cases of SIBO benefit a lot from going on a really, really strong digestive enzyme. I find that the pancreatin works a lot better than plant-based enzymes, so that will be another adjunct I usually throw into the mix, which is nice because the enzymes are helpful, I would say at least 80% of the time, maybe 90% of the time, and patients start to see benefits from those usually within the first couple of days of starting them. So it's just nice to see some symptom improvement sooner versus later from the enzymes while we're waiting for the herbs to work, waiting for the diet to work. And the enzymes are not just there as a Band-Aid, they're not just there as a symptom reliever. If you're digesting your food better, then there's going to be less food left behind for the bacteria to eat, or at least that's what seems to play out in clinical practice. So kind of enhancing the bacterial starving out arm of your treatment coupled with diet while killing them off with the antimicrobials. If you wouldn't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video. I would really appreciate it. So thanks in advance for taking a second to do that. And if you have any questions or comments on these topics or anything else, please post in the comment section, and I will do my best to answer as soon as I can.